Good evening, everyone. This is Emily Verhoeven reporting for Channel 5 News. We have a special report for you today. The Texas Department of State Health Services has confirmed that norovirus was indeed responsible for an outbreak of gastroenteritis seen at Holy Family Nursing Home in Brownsville, Texas. If you are thinking that norovirus sounds familiar, this bug has also been reported to be responsible for outbreaks among students at George Washington University and among passengers on multiple cruise ships. Norovirus is a very nasty bug that causes gastroenteritis, which has the telltale symptoms of vomiting, diarrhea, abdominal pain, nausea, and fever. Along with flu, diabetes, and obesity, norovirus has become another significant public health issue in America today. Joining us today, we have a member of the Outbreak Investigation Team who determined that the source of the outbreak was norovirus at Holy Family Nursing Home. Welcome, Ms. Cuddy. We're so glad that you could join us today. Could you tell us a little bit about norovirus and how it's transmitted?
Hi, I'm very glad to be here today. Well, norovirus is a highly infectious virus, mainly transmitted through contaminated food. It can also be transmitted from person to person due to improper hygiene and hand washing. And like you said, it causes diarrhea, and in severe cases it can lead to dehydration, which can be fatal, especially in the elderly.
And can you tell us a little bit about the Outbreak Investigation Team?
The team consists of Dr. House, the head of the team, Dr. Foreman, the medical doctor, Dr. Wilson, the environmental specialist, me, several data collectors, and the lab personnel.
And how did you determine that norovirus was actually responsible for the outbreak?
Our team collected several samples from the sick residents at the Holy Nursing Home, and they came back positive for norovirus. All the cases were also evaluated clinically by Dr. Foreman for definitive diagnosis and case classification. The team suspected that the oysters are the source of the infection, so we collected some samples of those oysters and analyzed them, and they came back positive for norovirus. The outbreak was typical, and luckily there was no fatalities, and it was controlled.
Well, I'm glad that your team controlled the outbreak and that there were no fatalities. And there was actually 2 outbreaks that occurred, correct?
Correct.
And what caused the second outbreak to occur?
The second outbreak was mainly due to improper hygiene. One of the personnel caring for sick residents did not use the proper protective equipment, and he got sick, and not just that, he passed out the virus to other residents.
Well, it sounds like hand washing is important in all circumstances, so keep that in mind, Rio Grande Valley. And thank you again, Ms. Cuddy, for joining us today. And one of our correspondents, Edwin Machine, is actually in Atlanta, Georgia today, reporting from the Centers for Disease Control and Prevention. Edwin, can you hear us?
Good evening, everybody, and thank you again, Emily, over there at Holy Family Nursing Home, where there was an outbreak. Your conversation with Ms. Cuddy has certainly enlightened our viewers on some important aspects of norovirus outbreak. As we know, norovirus infection generally tends to be mild and self-limited, and therefore tends to also be self-resolving through rehydration and analgesics. And the treatment for the more serious hospitalized cases involves mostly fluid and electrolyte replacements. To talk more about this, we have in our studios Dr. Mahajan, who is a specialist here at the CDC in the Department of Infectious Diseases. Welcome.
Good evening to you.
Okay, are you nervous?
No, actually, I've been presenting research papers at various conferences at national and even international levels, and I'm used to all these things, and it's just a piece of cake.
Okay, but you know that this is a local channel and not the national television, right?
Oh, yeah. Never mind.
But still on
Yeah.
TV.
Yeah.
Okay.
Yeah.
So here at CDC, we have published information on several measures to prevent further outbreaks of norovirus, as well as control of the infection. The CDC recommends hand hygiene, staff policies, patient isolation, education and surveillance, as well as environmental disinfection. My question to you is, which of these factors that I've just mentioned is most important to help prevent norovirus infection?
None of these factors can be singled out as the chief measure which guarantees the prevention, since collectively they all play an important role somehow.
Okay.
The latest CDC recommendations focuses primarily on hand hygiene, exclusion of sick staff, isolation of sick residents, and environmental disinfection. In addition to these general prevention measures which I just mentioned, other prevention measures specific to nursing homes should also be implemented.
Could you elaborate on these issues?
Sure. Our recommendations involve the preventive measures like avoidance of contaminated foodstuffs and water, like no direct handling of ready-to-eat foods by food handlers. Hand washing by all health providers at the nursing home as well as affected patients is strongly advised.
Do you have any particular instructions for hand washing?
Yes, thorough hand washing should be carried out with running water and plain antiseptic soap for at least 20 seconds. This provides the better results compared to use of alcohol-based and other hand sanitizers, whose efficacy still remains under question when it comes to reduction of viral RNA. Apart from that, disinfection of all virus-contaminated areas in the nursing home is very important. Initial cleaning of high-touch surfaces such as doorknobs, handrails, communal bathrooms is recommended to remove organic loads like fecal material and even vomitus for that matter, followed by chlorine bleach solution disinfection.
Okay. Are there any other important measures that we need to consider?
Yes, a very critical measure that needs to be kept in mind is the isolation and exclusion of ill patients themselves.
Okay.
Asymptomatically infected patients should be identified and isolated as they can still be shedding the virus.
Okay. Does education of patients and their family members play an important role in all this?
Oh yes, I'm glad you brought up that point actually. Patients, their family members and staff members should be educated regarding the symptom recognition of norovirus, understanding the basic principles of disease transmission, understanding the components of transmission based precautions, as well as cleaning and disinfection procedures. Poster presentations and one-on-one teaching with patients and visitors, as well as holding departmental seminars for the staff is strongly advised. I would like to take this opportunity to thank you and your channel in particular for spreading this important information across to the general public through this program. Thank you.
Well, thank you again for sparing time in your busy schedule, and for our viewers, the take-home message is next time you are on a cruise or say visiting a friend in a nursing home and who might have a norovirus infection, you know now what you should be able to take care of for them. Reporting from CDC, I'm Edwin Machine saying good night to all our viewers. So stay safe, Texas.